Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And it is with great honor that I present on behalf of Walden University at the British Society of Rheumatology Conference this year. The presentation is entitled Depression Modifies the Effect of Rheumatoid Arthritis on Overall Mortality Among Females. Let's go ahead and get started. So the objectives that I'll be going over, two main objectives: combined concept of physical and mental health, and then understand how rheumatoid arthritis plays a role. It's straightforward, simple, and the idea is to keep it as simple as possible. So introduction, just understanding what depression is, understanding what rheumatoid arthritis is, and understanding how the two are interrelated. So depression is a concomitant condition along with specific physical conditions. If you're thinking about specific conditions, chronic conditions, such as anything from diabetes to cancer to many different diseases, then one of the major parts of that is depression. After all, you're going to be dealing with this for such a long time that there's a sort of uncertainty and depression that sets in. It's a recognized mental health condition, and it affects many individuals. It's a public health crisis. When compounded by an autoimmune condition like rheumatoid arthritis, there can be harmful consequences. I'm going to actually show you a model at the end where pathophysiologically it makes sense that rheumatoid arthritis might have some mental health connections as well. So in this article specifically, we explored if depression modified the connection between rheumatoid arthritis and overall mortality. So in the methodology, what was done is it was conducted on participants 20 years and older living in the United States. And mind you, this is from the National Health and Nutrition Examination Survey dataset. And so we assessed rheumatoid arthritis status by using the arthritis question and the NHANES survey. So it's self-reported data, nonetheless reliable. This was between the years of 1999 and 2010 with follow-up, linked mortality follow-up to December 2015. And then, of course, depression was determined through the Patient Health Questionnaire 9, and this was also based on self-reported data. So as I said, this was linked mortality files, so we had the opportunity to actually use Cox regression. So it was a prospective analysis where complex samples Cox regression with adjustment for known confounders were used to assess and understand the precise role that depression plays in rheumatoid arthritis that leads to mortality. So just understanding how depression plays a role in that interaction. I like to use this model and understand what is going on. So as you can see, rheumatoid arthritis leads or is associated with all-cause mortality. That's what we're after. But not only that, how does depression modify that relationship between rheumatoid arthritis and all-cause mortality? How that modification is taking place is the third one up. So here's the results. As we can see, on the left, reference is 1. If anything above 1 is typically something noteworthy. So something that is interesting to note is that rheumatoid arthritis is still leading to a lot of mortality, 94% higher mortality than if you didn't have rheumatoid arthritis. What is even more noteworthy or interesting is that when you have both depression and rheumatoid arthritis, the likelihood is 113% more, or 2.13 odds ratio. Now, if you don't have both, if you just have rheumatoid arthritis, then it goes down to 1.9. While the numbers are not that far apart, it's still important to note that this is what is going on, and that there is a higher likelihood of mortality when you have both. So this is the model that I wanted to show you. It's interesting that multiple places there's actually antibodies which are crossing the blood-brain barrier. And cytokines that cross blood-brain barrier really cause a lot of inflammation. Also activation of the endothelium within the blood-brain barrier. And then direct access through circumventricular organs and activation of these. That's one of them. And then alterations to depressive behaviors and animals. Let's look at people. Alterations in people with depression, altered connectivity between brain regions, increased serotonin transporter, and then decreased glutamate creatinine. So these are physiological alterations that are taking place to cause depression. Of course, there's CNS changes from the cytokine-mediated dysfunction that I was telling you about. And then there's vagal nerve detection of circulating cytokines and transmission of signals to the CNS gland. So there's neuronal, humoral, there's a lot of different alterations that is causing this. So in conclusion, we have rheumatoid arthritis. Rheumatoid arthritis has poor outcomes, especially when they have depression. These patterns exist among females but do not affect males in the same way. And then screening for depression should be a priority among rheumatologists screening patients for other things. Thank you for listening.